Hello, you're with UnionLIVE here. We're live streaming from the Union World Conference on Lung Health for 2023. I'm Nadine DeRazo, your host here on this dedicated TV channel, and we're live streaming nearly 40 hours of essential conference content across the whole week. And we're broadcasting from 8:30 every morning, local time here in Paris, from the halls of the Palais de Congrès. So first this morning, training and education are key elements to help realise the Union's vision of a world free of TB. The organisation has broken new ground developing a hybrid training model of short and practical courses that are adapted to the context of health professionals working in low resource settings. And to look at this work in more detail, I'm joined by Lara Garrido, who is Director of Training and Education at the Union. Welcome, Lara, to UnionLIVE. Thank you so much for coming on the show. First of all, what makes the Union courses so unique?
So our courses are especially designed for people who are working in the field in low and middle income countries. So they are short. These are people that are quite busy. They are seeing patients every day and they just need the latest updates, the latest research, the best practices that is happening worldwide, and that's what our courses do. It's a short influx of information and skills to update the staff of national TV programs in low and middle income countries.
So that's what makes them unique, and already you've hinted at the target audience then, but just tell us a little bit more. Who specifically are you targeting?
So the Union courses are mainly for healthcare professionals. We have clinicians, laboratory staff, we have programmatic staff from national TV programs, but we also do courses for nurses and allied professionals, but it's mainly healthcare professionals. It's people who are working on TV, sometimes as well DRTV, who is a bit more of a specialized topic, but healthcare professionals mainly, yes.
And I know the pandemic changed the way you delivered your courses. Originally they were all in person and then you had to go online. But you've now developed a hybrid model, haven't you? So tell us a little bit more about that.
Yes, so traditionally we did 1 or 2 weeks in person. We will go in the country, train a group of people, or we will organize international courses by bringing a group of people from different countries, which also enrich the experience because then they can exchange. But obviously with COVID we had to stop that. We saw an opportunity there, and as many other organizations we turned into online. Initially it will be just short webinars. But then we started developing all our course materials into online format. But still, because our courses are very practical, you still need that interaction. We do a lot of field trips, we go to clinics, we see how TV is managed in different settings. So we decided to do most of the theory online, which is actually very good because it's a standardized content, everybody gets the same. And then the practical experience in field and also the networking that you get when you are in an in-person setting, yeah.
And I suppose online, as you said, it makes it so equal, the access, and you're making sure that the standards are, completely equal across the board. So what actually happens in the on-person courses now? Because there's still that importance of meeting face-to-face. So has that changed?
So we always got the feedback. We do regular surveys after our courses, and even during COVID, everybody said we still need in-person. When are we going back to in-person? So there is a need for the in-person. So we try to do fewer lectures, so we don't have a full room of people sitting all day, lecture after lecture. We do a refresher, we do a lot of questions and answers, we prepare exercises. We know that the people have already completed a set of content, so there is a baseline there, and then we will just go and have 2 or 3 days of field visits where we give them the role, for example, in the basic TV course, we will give them the role of TV supervisors, and so they have a sheet to complete and they have to collect data and they have to observe and then they have to prepare and present to the rest of the group. So it's very practical and yeah, it's very popular.
I can imagine, and chance to clarify any of the online content as well, isn't it, when they're face-to-face too. But how do you actually maintain the quality of your courses?
So from the inception, so we do a needs assessment. We work with national TV programs. All our experts are actually embedded in some of the countries where we work. They do operational research. So from WHO guidelines, operational research, we create the content of the courses. We create a guide and then we create the content. So there we know we are catering to the needs of the national TV programs. We also have annual impact surveys where we learn about the needs of countries and which topics they need to be updated on. Right now, we are getting a lot of information about the high turnover during the COVID crisis. There wasn't a lot of training going on, so a lot of the staff really need to refresh their skills on basic TV, but also DRTV, childhood TV, yeah, all the topics. So we are in constant communication with the national TV programs to find out what their needs are. And then we do this 6 months later. We ask the participants if they have implemented some of the knowledge that they acquire in the course. And so we try to always include that feedback into the new edition of the course.
So continuous learning really all the time, isn't it?
Yes.
And how about the funding? Where does that come from to deliver these courses?
So the union is a non-for-profit. We don't have our own funds, but we work with partners such as the Global Fund, USAID, the CDC in the US. And so most of the free content that we offer online is sponsored by some of these big organizations or even corporations, some of the corporations that will give us a grant to develop some online courses that are available for free. And then we have international courses that have a cost. So we have a model where everybody pays a little, so the participants will have to pay to attend, especially the in-person. And most of the time the participants get sponsorship from their employer or a domestic organization that will pay for that. But yeah, we are always looking for funds to offer more and more content for free. But some of our courses have a little course fee that has to be paid, yes.
And finally, are your courses accredited? And also I'd love to find out, what impact have the courses had?
So we are an international organization, so we had to find an accrediting organization that will be good for a variety of people in different countries. So we have partnered with EACME, which is the European Accrediting Organization for Medical Associations. And so once you complete the course, even the online courses, you get an amount of credits towards your medical professional development. So yeah, we are accredited by an international organization. Sometimes we are asked, why don't you get accreditation by a local university? But then those credits will only will be good for the people in that country. But we are an international organization, so we have to cater for everybody.
Well, thank you so much, Lara Garrido, who's Director of Training and Education at the Union. Thank you so much for speaking to us.
Thank you for having me.